My name is Natasha Volkov, and I've been an intensive care nurse at Massachusetts General Hospital in Boston for 17 years. I work in the cardiac intensive care unit, patients who've had heart attacks, post-cardiac surgery recoveries, critical cardiac conditions. Every day, I care for people walking the thin line between life and death. I've been doing this job for 17 years. I've learned to read monitors, calculate medication doses, sense when a patient is about to deteriorate. I understand heart rates, blood pressure values, oxygen saturation. As an ICU nurse, doctors make decisions but I implement them. I administer medications, manage life support equipment, stand by patients' bedsides for hours. But on October 8, 2023, something changed. I started seeing something above patients. A digital counter. Red numbers, suspended in air, constantly counting down. Remaining lifespans. Accurate to the hour, minute, and second. And no medical intervention could stop these counters. We could only slow them down. Or speed them up. Massachusetts General Hospital is one of Boston's most prestigious hospitals. Our cardiac ICU has 24 beds, state-of-the-art monitors, mechanical heart support devices, experimental treatments. The doctors working here graduated from Harvard Medical School. The nurses received the best training. We're one of the country's leading centers for cardiac disease. I was born in Moscow, immigrated to America with my family when I was 14. My father was a software engineer, my mother a chemist. We settled in Boston because my father found work at MIT. I wanted to study nursing, to help people directly, to use medical knowledge in daily care. I studied nursing at Boston College, graduated in 2006, started working at Mass General. 17 years later, I'm now head nurse. I manage the night shift, 7 p.m. to 7 a.m. Night shift in intensive care is the most critical. Fewer staff, fewer doctors, but patients are just as sick. You have to make decisions quickly. I'm calm, fast, detail-oriented. I've been doing this job for 17 years and I'm still here because I'm good at it. October 8, 2023, Sunday night. I started my shift at 7 p.m. Routine night, 21 of 24 beds occupied. Heart attack patients, post-bypass surgery patients, congestive heart failure, standard cardiac ICU cases. At 9:47 p.m., a new patient arrived in bed 12. Robert Morrison, 58 years old, white male, massive heart attack 6 hours ago, stabilized in the ER, stent placed in the cath lab, now in ICU for monitoring. His vital signs were weak but stable. Heart rate 92, blood pressure 98/60 seconds, oxygen saturation 94%. Not bad but not good either. The first 48 hours were critical. If he didn't have another heart attack, he'd probably recover. I connected the patient to monitors, checked 4 lines, adjusted his medications. Standard procedure. Robert Morrison was awake but tired, didn't want to talk. His wife was beside him, holding his hand. At 10:15 p.m., when I returned to Robert's bed to check his vital signs, I saw it. Above his head, suspended in air, red digital numbers. 18 hours 34 minutes and 52 seconds. The seconds were counting down. 51, 50, 49. I blinked. The numbers were still there. Bright red, like an LED display, but not physical. Like a hologram projected into the air. 18 hours 34 minutes and 42 seconds. I reached out, tried to touch the numbers. My hand passed through empty space. Like a ghost. I looked at Robert Morrison. He was sleeping. His wife was looking at her phone. Neither of them saw the counter. I called another nurse. Lisa. Lisa, can you look at something here? Lisa came over. What is it? Above Robert's head. Do you see anything? Lisa looked up. Like what? Numbers. Red numbers. Lisa looked at me strangely. Natasha, there's nothing there. Are you okay? I looked again. The counter was still there. 18 hours 33 minutes and 15 seconds. I'm fine, I said. Just tired, I guess. Lisa left. I stared at the counter. 18 hours, 33 minutes, 12 seconds. What did it mean? Throughout the night, I checked every patient for counters. Only Robert Morrison had one. No other patients showed anything. At 7 a.m. my shift ended. I went home, tried to sleep, but my mind was on Robert Morrison's counter. 18 hours 33 minutes. Counting down to what? The next night, October 9th, when I returned to my shift, my first task was checking Robert Morrison. He was still in ICU. His condition was stable. Monitors showed normal values. The counter above his head, 5 hours 12 minutes and 38 seconds. 5 hours 12 minutes remaining. Until what? At 2 a.m., Robert Morrison's monitor started alarming. His heart rhythm was becoming irregular. Ventricular fibrillation, a lethal rhythm where the heart just quivers instead of pumping effectively. We called a code blue. The doctor came running. We prepared the defibrillator. I looked at the counter, 3 minutes and 17 seconds. 3 minutes 17 seconds. Charge 200 joules. The doctor shouted. We shocked him. Robert's body jumped. We checked the monitor. Still fibrillation. 2 minutes and 45 seconds. Charge again 300 joules. Second shock. Still fibrillation. 1 minute and 58 seconds. We started CPR. Chest compressions, ventilation, medications. Epinephrine, amiodarone. We tried everything. 47 seconds. Robert Morrison's heart corrected. It returned to sinus rhythm. The monitors stabilized. I looked at the counter. Midnight, 0. Then Robert Morrison's heart stopped. Flat line. Asystole. We did more CPR. For 20 minutes. But he didn't come back. At 2:34 a.m., the doctor pronounced him dead. The counter had started 18 hours 34 minutes earlier. It had shown exactly when Robert Morrison would die. Remaining lifespan. The next night, October 10th, when I started my shift, I checked every patient. I was looking for counters. Bed 7, Margaret Chen, 72, heart failure. Above her head, 127:45:12, 5 days. Bed 15, David Park, 45, post-bypass surgery. No counter. Bed 3, Emily Watson, 34, cardiomyopathy. 9 hours 17 minutes and 33 seconds. 9 hours. Bed 19, Michael Torres, 67, heart attack. 312:22:18, 13 days. Some patients had counters, some didn't. Those with counters would die. Those without would recover. Emily Watson's counter showed less than 9 hours. Her monitors looked normal, stable, but she'd die within 9 hours. Could I tell the doctor? What would I say? I see a digital counter above the patient's head. She'll die in 9 hours? But I had to do something. I reviewed Emily Watson's file. Dilated cardiomyopathy, weakening of the heart muscle. She was on medication therapy. She looked stable. But the counter showed 9 hours. At 4 a.m., I went to Emily's room. She was sleeping. Monitors normal. Heart rate 78. Blood pressure 105/68. Oxygen 96%. Counter. 5 hours 2 minutes and 41 seconds. 5 hours remaining. I found the on-call doctor, Dr. James Rodriguez. Dr. Rodriguez, I'm worried about Emily Watson. Why? Her monitors look stable. I don't know, I just have a bad feeling. Maybe we should monitor her more closely. Natasha, you've been here 17 years. If you have a bad feeling, I listen. What do you suggest? Maybe increase EKG frequency? Recheck cardiac enzymes? Troponin levels? Okay, let's get new blood work. But the monitors really do look normal. At 6:30 a.m., the blood test results came back. Troponin levels had risen. Emily Watson's heart was silently being damaged. The monitors hadn't shown it yet. Good catch, Dr. Rodriguez said. Let's get her to the cath lab emergently. Emily Watson was taken to the catheterization laboratory. They found severe blockage in one of her coronary arteries. They placed an emergency stent. At 9:15 a.m., Emily returned to ICU. The procedure was successful. Her condition was stable. I looked at the counter. It was still there. But it was no longer 5 hours 2 minutes and 41 seconds. 67 hours 34 minutes and 19 seconds. 67 hours. Nearly 3 days. The counter had changed. We'd intervened. Extended Emily's life from 9 hours to 67 hours. But she would still die. Just later. Over the next 2 weeks, I monitored the counters. Every patient, every shift. Some counters were long, days, weeks. Some were short, hours. And every intervention changed the counters. The right medication, at the right time, the counter extended. Wrong decision, the counter shortened. Margaret Chen's counter was 5 days. We adjusted her heart failure medications, optimized her fluid balance. Her counter increased to 12 days. Michael Torres's counter was 13 days. He developed an infection. We gave antibiotics. Counter dropped to 9 days. Stronger antibiotic counter increased to 15 days. Every decision, every intervention, affected the counters. And I was the only one who could see them. On October 22nd, a case came that changed everything. Bed 8, Daniel Foster, 9 years old, congenital heart disease. He'd had multiple surgeries. Now he was in heart failure. He was on the transplant waiting list. The counter above his head, 4 hours 15 minutes and 22 seconds. 4 hours 15 minutes. A 9-year-old child. He'd die within 4 hours. I checked his monitors. Bad but not critical. Heart rate 115, blood pressure 85/50ths, oxygen 91%, weak but stable. But the counter showed 4 hours. I went to Dr. Rodriguez. We need to watch Daniel Foster closely. I have a very bad feeling. His monitors are weak but stable. What do you suggest? I don't know. Just, something's going to happen. Within 4 hours. Dr. Rodriguez looked at me. Natasha, something's going to happen is very specific. How do you know? I don't know. I just feel it. Okay, let's watch him closely. But right now there's not much we can do. He's already on maximum medication support. At 2 a.m., Daniel's counter showed 30 minutes and 17 seconds. 30 minutes remaining. His monitors were still the same. Bad but stable. I stood outside his room, waiting. Something was going to happen. But what? At 2:28 a.m., Daniel's mother called to me in the hallway. Nurse, Daniel can't breathe. I ran. Daniel was sitting up in bed, gasping. His lips were turning blue. His oxygen saturation had dropped to 78%. Code blue. I shouted. The team came running. We laid Daniel down, put an oxygen mask on him. But it wasn't enough. We needed to intubate him, insert a breathing tube and connect him to a mechanical ventilator. Dr. Rodriguez performed the intubation. He placed the tube. We connected him to the ventilator. Daniel's oxygen saturation started rising. 82%, 87%, 91%. I looked at the counter. 2 minutes and 13 seconds. 2 minutes remaining. Heart rhythms becoming irregular. Lisa shouted. The monitor showed ventricular tachycardia. Fast. Irregular heart rhythm. Lethal. Prepare for cardioversion. Dr. Rodriguez said. We prepared the defibrillator. We sedated Daniel. We shocked him. The rhythm corrected. Sinus tachycardia. Fast but regular. Counter. 47 seconds. 47 seconds. Blood pressure's dropping. I said. 60/30ths. Epinephrine now. Dr. Rodriguez shouted. I gave epinephrine. Blood pressure started rising. Counter. 12 seconds. 12 seconds. Daniel's heart slowed. Bradycardia. Then it stopped. Asystole. Lisa shouted. We started CPR. Chest compressions, ventilation, medications. Counter. Midnight. 0. We did CPR for 20 minutes. Daniel didn't come back. At 2:51 a.m., Dr. Rodriguez pronounced him dead. A 9-year-old child. The counter had started 4 hours 15 minutes earlier. He'd died exactly on time. I knew. 4 hours earlier I knew. But I couldn't save him. The next day, October 23rd, before my shift, I met with Dr. Rodriguez. How did you know about Daniel Foster last night? 4 hours earlier you said, something's going to happen. How did you know? I didn't know. I just had a bad feeling. Natasha, you've been here 17 years. Your instincts are usually right. But this was very specific. You said 4 hours. And exactly 4 hours 15 minutes later he coded. Luck. Not luck. For the past 2 weeks, you've been predicting when patients will deteriorate, hours in advance. Emily Watson, Margaret Chen, Michael Torres. Every time you're right. How are you doing it? I couldn't tell him the truth. Experience. Reading monitors. Noticing small changes. The monitors showed nothing on Daniel. But you knew. I stayed silent. Natasha, you need to tell me something. If you've developed a method to predict patient deterioration, you need to share it. We should teach other nurses. I can't teach it. Because I can't explain it. Dr. Rodriguez frowned. Why not? Because no one would believe me. On October 27th, another case came. Bed 14, Sofia Martinez, 6 years old, congenital heart defect, post-surgery recovery. Her monitors were perfect, stable, strong. She'd be discharged tomorrow. But above her head was a counter. 2 hours 47 minutes and 19 seconds. 2 hours 47 minutes. This was impossible. Sofia was recovering. Her monitors were perfect. She was going home tomorrow. But the counter showed 2 hours 47 minutes. I went to Dr. Rodriguez. We need to check Sofia Martinez. Why? She's in perfect condition. We're discharging her tomorrow. I know, but, please. Just check her one more time. Dr. Rodriguez looked at me for a long time. Natasha, again? Another bad feeling? Yes. Okay. But if we start checking every stable patient, we'll never finish our work. He examined Sofia. Everything was normal. Heart sounds clear, lungs clear, monitors perfect. Natasha, she's completely fine. She's going home tomorrow. But the counter showed 2 hours 30 minutes. At 11:15 p.m., Sofia's mother came to the nurse's station. Sofia looks a little tired. Can you check her? I ran to Sofia's room. She was awake but pale. Her monitors were still normal. Counter, 18 minutes and 42 seconds. 18 minutes. Dr. Rodriguez, get here now. Dr. Rodriguez came. What is it? I don't know, but something's wrong. He examined Sofia. Monitors are normal. Maybe she's just tired. No, something's wrong. I can feel it. Dr. Rodriguez looked at me. Then at Sofia. Okay, let's do an echocardiogram. Let's look at her heart. We brought the echo machine. We imaged Sofia's heart. And we saw it. Fluid in the pericardium. Blood accumulation in the sac around the heart. Cardiac tamponade. The heart was being compressed. Couldn't pump. A rare complication after surgery. The monitors hadn't shown it yet because it was developing slowly. Emergency pericardiocentesis. Dr. Rodriguez shouted. Now! We prepared the equipment. Dr. Rodriguez inserted a needle into Sofia's chest, drained the blood from the pericardium. 60 milliliters of blood came out. Sofia's heart relaxed. I looked at the counter. 47 hours 12 minutes and 35 seconds. 47 hours. Nearly 2 days. We'd saved Sofia. The counter had increased from 18 minutes to 47 hours. Dr. Rodriguez looked at me. How did you know? The monitors showed nothing. I don't know. I just knew. Natasha, this is the third time. Emily Watson, Daniel Foster, now Sofia Martinez. Every time you predict patient deterioration hours in advance. This isn't intuition. This is something else. I don't know what it is, but you're seeing something, aren't you? I stayed silent. Natasha, you can talk to me. What are you seeing? I took a deep breath. Counters. Above patients' heads. Digital counters. Showing remaining lifespans. Dr. Rodriguez looked at me. A long silence. Counters. Yes. Red digital numbers. Hours. Minutes. Seconds. Counting down. When they reach 0, the patient dies. And only you can see them? Yes. Dr. Rodriguez sat down. Natasha, that's a very serious claim. You're saying you can see when patients will die. I know how it sounds. But it's true. Daniel Foster's counter showed 4 hours 15 minutes. He died exactly then. Sofia's counter was 18 minutes. We intervened. It increased to 47 hours. What if we hadn't intervened? She would have died in 18 minutes. Dr. Rodriguez shook his head. Natasha, I've known you for a long time. You're an excellent nurse. But this is impossible. I know. But it's real. Can you prove it? How? Only I can see the counters. On the next patient, tell me what the counter shows. Let's see if it's accurate. On November 1st, a new patient arrived. Bed 11, Gregory Williams, 71, massive heart attack. He was in very bad condition. On a mechanical ventilator, maximum medication support, mechanical heart support device. Counter, 45 minutes and 17 seconds. 45 minutes. I told Dr. Rodriguez, he'll die in 45 minutes. Are you sure? That's what the counter shows. Okay, let's watch. 44 minutes later, Gregory Williams's heart stopped. We did CPR, but he didn't come back. He died exactly 45 minutes 12 seconds later. Dr. Rodriguez was shocked. How? How did you know? I told you. The counter. But this is impossible. But it's real. Over the next 2 weeks, Dr. Rodriguez tested me. On every new patient, he asked what the counter showed. Every time I was right. Some patients died within hours. Some died days later. Some recovered. They had no counter. Every prediction was accurate. On November 15th, Dr. Rodriguez called me to his office. Natasha, we need to talk about your ability to predict patient death times. I need to report this to hospital administration. Why? Because this is incredible. If you can really see when patients will die, this is revolutionary for medicine. But also, concerning. How is it concerning? Because we can't explain it. How are you doing it? What's the mechanism? If there's no scientific explanation, you're saying psychiatric problem? No. But hospital administration might think so. On November 18th, I met with hospital administrator Dr. Patricia Hall. Nurse Volkov, Dr. Rodriguez says you can predict when patients will die. Yes. How? I see counters above patients' heads, showing remaining lifespans. And only you can see them? Yes. Dr. Hall took notes. Nurse Volkov, do you understand this is a very unusual claim? Yes. And no one else can see these counters? No. So how do we know they're real? Maybe you're just very good at predicting. We tested on 17 patients. Every time I was accurate, to the minute. Or you're very lucky. Or your subconscious is reading monitors and making predictions. The monitors showed nothing on Sofia Martinez. But I knew she'd die in 18 minutes. And you intervened, saved her. That's excellent nursing. But saying, I see counters, that's concerning. Why? Because it could be a hallucination, a symptom of psychotic disorder. But my predictions are accurate. For now. But what if one day you make a wrong prediction? What if you write off a patient as going to die, but they recover? Or vice versa? The counters don't lie. Nurse Volkov, I'm placing you on mandatory psychiatric evaluation. On November 22nd, I met with hospital psychiatrist Dr. Ellen Morrison. What do you see above patients' heads? Digital counters. Red numbers. Remaining lifespans. And are these counters real? They're real to me. But no one else can see them? No. So how does this make you feel? Terrible. Every time I look at a patient, I know when they'll die. Whether I can save them or not. The counter's counting down. I'm helpless. Helpless? But you can intervene. You saved Sofia Martinez. Yes. But I couldn't save Daniel Foster. His counter showed 4 hours. I knew. But it wasn't enough. Do you feel guilty? Yes. Because I knew. And I couldn't save him. Dr. Morrison took notes. Nurse Volkov, your experiences show symptoms of post-traumatic stress disorder. You've worked in ICU for 17 years. Hundreds of patients have died. This can affect your mental health. I'm not delusional. I didn't say that. But saying, I see counters suggests a problem with reality perception. My predictions are accurate. For now. But this isn't sustainable. If you see death times on every patient, that's very traumatic. Burnout syndrome, dissociation, hallucinations can develop. It's not a hallucination. It's real. Nurse Volkov, I can't clear you for work. I recommend at least 4 weeks administrative leave and therapy. On November 25th, I was placed on administrative leave. My 17-year career was suspended because I could see when patients would die. But the counters didn't disappear. Walking on the street, I saw counters above people's heads. Most had none, but some did. An old man at the bus stop. Counter, 3 hours 12 minutes and 45 seconds. 3 hours. A young woman in a cafe. Counter, 47 minutes and 22 seconds. 47 minutes. Could I tell them something? say, "Hello, you'll die in 47 minutes?" No one would believe me. In December I went to therapy. Dr. Morrison met with me twice a week. Do you still see the counters? Yes. Everywhere. Not just in the hospital. How does this make you feel? Helpless. I see death but can't stop it. Maybe stopping it isn't your job. Maybe just accepting it. How can I accept it? I see a 9-year-old child will die in 4 hours. How can I accept that? Because some things can't be changed. Medicine is limited. Some patients will die, no matter what you do. But I can save some. Like Sophia. Her counter was 18 minutes. We intervened. It increased to 47 hours. And that's wonderful. But you can't save every patient. I know. But I have to try. On January 2nd, 2024, hospital administration made their decision. Dr. Hall called me to her office. Nurse Volkov, we've reviewed Dr. Morrison's report. We can't return you to clinical duties. Why? Because we can't have a nurse who says, "I see patient death times working in ICU." What would families think? Other staff. But my predictions are accurate. I'm saving patients. For now. But what if one day you make a mistake? What if you give up on a patient early because the counter shows 0? The hospital can't take that risk. I would never do that. We can't know that. I'm sorry. Nurse Volkov. We're offering you 2 options. Resign. We'll give you a neutral reference. Or formal disciplinary process, probably termination. So either I leave on my own or you fire me. Yes. On January 8th, 2024, I resigned from Massachusetts General Hospital. My 17-year career was over. Because I could see when patients would die. But the counters were still there. Every day on the street, in stores everywhere. Counters above people's heads. Most had none. But some did. And I couldn't do anything anymore. I wasn't a nurse anymore. In February, I got an email from a former colleague. "Lisa. Natasha, we miss you. But I need to tell you something. After you left, we lost 2 patients. Emily Watson and Michael Torres. Both looked stable. But they suddenly deteriorated. If you'd been there, maybe you would have noticed. Maybe you would have saved them." Emily Watson. Her counter had been 67 hours. She must have died 3 days later. Michael Torres. His counter had been 15 days. Both had died. Because I wasn't there. Because no one could see the counters. In March, I found work at a small private clinic. An elderly care home. A place where death was expected. On my first day, I met 15 residents. 8 had counters. I didn't tell the manager. I just watched. As the counters decreased, I called families. Maybe you'd like to visit. Soon. Some came. Some didn't. But at least I warned them. In April, a woman came. Middle-aged. Looked tired. "Are you Nurse Volkov?" "Yes. I'm Dr. Jessica Martinez. I used to work at Mayo Clinic. I was a surgical tech. Until I started seeing 2 versions of reality." I looked at her. "You too?" "Yes." In surgeries, cameras recorded one thing. My eyes saw something else. No one believed me. I was fired. Me too. I see patient death times. No one believed me. Jessica smiled. "You're not alone, Natasha. There are more people in medicine who see impossible things, and we've all been punished. What can we do? I don't know. But we can find each other, support each other. And maybe one day someone will believe." It's now May 2024. I resigned 4 months ago. I'm not at Mass General anymore. I work at a small care home, but I still see the counters. Every day, every patient, and as each counter decreases, I make a decision. Can I intervene? Can I extend it? Or do I just accept it and prepare the family? Some patients can be saved, some can't. But on all of them, I know when they'll die. This is my curse. This is my gift. And this is my new reality. Yesterday, a new resident arrived at the care home. Margaret Foster, 83 years old, heart failure. Counter above her head, 168:34:12. 7 days. I spoke with her family. Maybe you'd like to visit frequently. She may not have much time. The doctor said stable. I know. But sometimes things change quickly. Just be prepared. 7 days later, Margaret Foster died. Her family was with her. They were prepared. They thanked me. How did you know? Experience, I said. 17 years working in ICU. But the truth was, I'd seen the counter. And every day, I see more counters. Because I'm Natasha Volkov. I'm 41 years old. I was an ICU nurse at Mass General for 17 years. And now, I'm the only person who can see when people will die. This is my curse. This is my gift. And this is the reality I have to live with. The counters never lie. But no one believes. And I see death every day. Hours. Minutes. Seconds. The countdown never stops.